everyone. It's the Powerhouse Podcast. I'm your host, Brian Harmon, President and CEO at the United Mitochondrial Disease Foundation. I'm joined by a special guest co-host today, Miss Cassie Franklin. Cassie, you're not a stranger to the podcast. In fact, you've hosted this podcast before.
Yeah. I was trying to think. I think the last time I hosted was actually February of last year. I was on with Nicole.
Yes. Women in Science.
Women in Science Month.
So
yes.
We felt it prudent to let the gentlemen step back a little bit and have our dedicated ladies run the podcast that day. And if I'm not mistaken, it was one of our widely viewed episodes. So kudos to you, Nicole. And it might say more about me and Dr. Yeski, but I'm glad to have you with us today. And well, you're living the brand of Rare Disease Month too. I see you're showing your stripes today.
I am. I need to remind everyone that Rare Disease Day is coming up February 29th. And it's the best opportunity, one of the great opportunities during the year to share your story and remember to show your stripes.
We're going to talk a lot about this today with our guests too, about awareness building, bringing attention to mitochondrial disease. And it's so important that we take this opportunity for really a thunderclap of activity. When we see so much activity at once, it gets a lot of eyes on screens. And that's something that's really important to our organization. And that's really where you spend most of your time, Cassie. It's been a while since our community may have heard from you. And I think it'd just be helpful to share a little bit about what your day-to-day looks like here at UMDF.
Thank you. I'd love to. So probably the last time I've maybe been on screen was during our conference last year, coming out of Charlotte, kind of reporting out on everything that was happening day to day as the conference went along. But yeah, usually I'm behind the scenes. I work on all of our social media work. I work with the communications team on all of our written pieces, some things for the website or the blog posts or newsletter or campaigns. But really these are all opportunities to elevate the patient voice at the end of the day. And that's the part of my job that I love doing the most. I feel like I've been doing it, even though I've only been in communications for 2 years with UMDF. I feel like this is what I've always sought out since I started with UMDF back in 2012, is like ways to connect with patient families, hear their stories, make connections between patient families, between doctors, researchers, and really help to elevate their patient experiences.
It's really the core of what we do is making sure that the patient voice is always center of any strategy discussion or advancing any of our key initiatives. And it ultimately comes down to storytelling. When I came here, I planted a flag and put this embargo in limited pictures of the mitochondria. It's important to see the mitochondria, but show me the pictures of the kids and the parents and the adults who are on this mito journey and part of what you get to do every single day. And another place that you intersect for our organization is with the donor community as well. And February is always, there's a lot happening in February. We got Rare Disease Month. We're going to talk a little bit about heart health, heart awareness, and its connection to mitochondrial disease. It's also a time for us that we take some extra special love for our donors. And I know that's a big part of what you focus on, Cassie, is drawing the connection between the impact of what we do and our donor community.
Yeah. I've always just taken really special interest in our donor communications channel, if you will, and helping to communicate just our love and gratitude for all of those supporters, but then also connecting them with stories from our patients as well. So around Valentine's, we usually send out a Valentine card. And you mentioned storytelling, but also photos. You can tell such great stories from great photos. So we try to feature our patients and our patient stories as much as we can, and communicating how important those donor dollars are, and that they're being put to work for the Mito patient community. So yeah, we show a lot of donor love in February. We've got, it's also, February is just the month. It's also the double your donation month. So
nice. Good plug.
I want to give love to our recurring givers, those folks that get matches and those folks that, sign up for those sustaining giving opportunities. And then also we've got Energy for Life walkathons kicking off this spring, and the first ones are starting in March. So we've got a lot of opportunities to just build energy and show our gratitude as well.
You're doing a fantastic job. I know there's so many ways for folks to get involved this month and every month at UMDF. And we've mentioned it a couple of times here, but we're hyper focused on Heart Month right now. And I know, Cassie, you've shared with me that this is it's a month that's of particular interest and a passion of yours too, in terms of building awareness.
Yeah. And you didn't know this and would have had no idea. Heart Month has always been really important to me. I had a cardiac ablation as a teenager. So I have Wolff-Parkinson's-White syndrome, which was not discovered until I was 14, 15 years old. So, American Heart Month has always been really important to me. And working with the Mito community, there are so many of our patients and our patient community who experience cardiac issues and heart-related symptoms related to mitochondrial disease. So we want to raise awareness of that and make sure that people are who might be at risk for developing cardiac issues are getting screened if they need to be screened for certain things. Like at the beginning of this month, we made sure to post that a third of the registrants in MitoShare, our patient populated registry, are affected with some sort of heart-related symptom or experience cardiac issues as a part of their mitochondrial disease experience. So we need to raise the awareness of that too, and American Heart Month is a great time to do that.
We often talk about the web of connectivity with the mitochondria to other parts of the body, and as you've noted, the heart is no exception. And that's why we've selected our special guest today to come talk a little bit more about Mito and heart awareness, and again, bringing in someone who is passionate about Heart Month and passionate about mitochondrial disease. We couldn't think of a better guest than to bring on Dr. Heather Gatcombe. Dr. Gatcombe is an MD and assistant professor, radiation oncologist at Emory University School of Medicine. She's a physician. She's a mom of 3. And she told me in our pre-interview, like, the number one job, though, she's a Mito mom. That's why we have her here today. And Dr. Gatcombe, if I can call you Heather, it's good to be with you today, and delighted to have you on the podcast.
Well, thank you for having me. It's a pleasure to be here.
We're going to jump right in. So our guests on our podcasts, oftentimes we have donors, advocates, doctors, Mito moms, Mito dads. You check a couple of these boxes, so I think it's going to be a great conversation today. And I'm not nervous about not having enough things to talk about today, Heather. But I would like to go in and just walk us through a little bit of your family's mitochondrial disease journey.
So when my eldest, who's now 15, when he was in second grade, so about 8. I received a call that it looks like he had a stroke. He couldn't move half of his body. He had a facial droop. And his teacher had to carry him to get to the school nurse. And by the time the ambulance came, he was actually back to baseline and normal. And they were deciding, do we even bring him to the hospital? Well, I'm glad they did. We would have taken him anyway. And when we first got there, they said, it could be just hemiplegic migraines. But when they did the brain MRI, they saw some changes that seemed consistent with mitochondrial disease. He had all the blood tests done. He had an LP. We had genetic testing. Everything was negative. And we came back to review the genetic testing about 3 months later. Everything was negative, but we were told this looks like mitochondrial disease. It looks like he's having metabolic strokes. You will always need to be near a pediatric ICU. We are lucky that it was reversible now, but if these keep occurring, his neurological symptoms may not be reversible, which was terrifying and frightening. He did well. We were still without a diagnosis. A few months later, he just happened to test. He had an abnormal hearing test, which we were surprised at because at conversations, we didn't notice any difference. And they said this is very consistent with mitochondrial disease. A lot of children have sensory neural hearing loss. And then he had another metabolic stroke. And they can switch sides, whether he has hemiplegia on one side or the other. And they would happen about once or twice a year. Testing was always negative. So we decided to get a second opinion. We went to Boston Children's. We were able to get an online second opinion at Cleveland Clinic. And it was the same. They weren't quite sure what was going on, but this could be mitochondrial disease. A few years later, our geneticist at Emory was at Grand Rounds, and Dr. Marnie Falk came down from CHOP in the Frontiers in Mitochondrial Medicine Clinic, and they did a curbside on my son's case. And she said, well, we're very interested in seeing him at CHOP. And that started yearly visits up there. And again, for a few years, the tests were all negative. He eventually had a muscle biopsy that showed his mitochondria work fine, but there's about 60 to 70% less than there should be. And they just kept rechecking his genetic panel. And we actually just got a diagnosis about a year or two ago. One of his VUSs, or variants of uncertain significance, became significant. And he does have a nuclear DNA change, a different mutation for both my husband and I that led to this variant. And just so it was 2 years ago where they found it. Last year when again, there was a case series with other children who presented like my son. So it's frustrating, but for us, it took us 5 or 6 years to get a diagnosis. And for some families, as you know, that's way too long. Because
I want to talk more about that. Can you take me back a little bit? So you're a trained physician, and I think Cassie, a lot of the work we do at UMDF is designed around meeting the panicked parent at their moment of panic, right? So that's our website, that's our social media, that's our support program, all of it. You may be outside the kind of typical description of a parent who hears mitochondrial disease the first time, but I want to hear from you on that. Like, what was your baseline of understanding around mitochondrial disease when you first heard that?
I didn't know anything about mitochondrial disease. So I had this discussion with my husband. We are both physicians.
Yeah.
I don't remember, I finished med school maybe 2004. I don't recall having a lecture on mitochondrial disease. My husband remembers one. I don't recall. So there's a lot of learning as you go, but it's terrifying. It's a very different position when you're there as your child's parent. You're not there as their physician. And so even if you have some knowledge base, it's overwhelming and you're just full of fear and terror, and you want to do what's best to help your child.
Yeah, I want to dive into that a little bit later, and just in terms of some work we can all do together as a community to help educate clinicians. We're doing some work on our end at UMDF with developing some curriculum, but we know it's a bigger wheel to turn in terms of kind of a cultural change from an overall education standpoint. But as we continue on the path of your story, and particularly in light of American Heart Month, talk to us a little bit about your son's experience with heart failure and where this kind of led your family next.
Well, being part of the CHOP clinic, we were told to see all the specialists because, as you know, mitochondrial disorders can affect many different organs. So when we go up there, we see neurology, we see nephrology, we see the pulmonologist, we see cardiology, we get pulmonary function testing, we get cardiopulmonary testing. So we were seeing all the subspecialists even before he had any symptoms. And he was doing great. We were told your tests are negative. Maybe see us in 2 years because he's doing great. And as part of his workup, he had an EKG about 4 years ago that looked a little abnormal. And we saw the cardiologist, and he wasn't too worried about it. But he said, let's go get an echocardiogram, which was fine. A few months later, he had a Holter monitor, which was also fine. We were told everything looks good. But then he was getting more tired. And then he started having some GI side effects. So he started having some nausea. And this was in the midst of COVID. So unfortunately, at that time, all the visits were telemedicine. So we were doing all video visits, and we were getting COVID tests. We were waiting for a PCR test, which were hard to get at that time. And in the midst of that, he just wasn't getting better. So we just took him straight to the emergency room. We thought, okay, he's dehydrated and he's a mitochondrial kid. So we know they deal with infections differently and harder, and it takes longer to clear them. So we brought him in with what we thought was for IV fluids, and we're told, no, he's an acute heart failure. And we were stunned. I mean, all the tests were negative. My husband and I are both physicians. We totally missed it. And I totally beat myself up for a year after that. The fact that I had missed these signs, it was very sudden.
And not that I would suggest that it can be comforting to know this, but to think that that happens probably over and over across many cases of Mito patients. I think, again, it begs the opportunity for us to constantly be educating and build awareness. And Cassie, this is something that's, this isn't a new story for us in our community when we talk to families who kind of have these multi-systemic touch points throughout their journey. I know you've experienced that just from talking to so many different families, Cassie.
Yeah, absolutely. Yeah. When Heather and I first talked, she said, have you heard of, another person or a patient who has experienced heart failure and gone through, what? And yes, it's probably not at that young of age. No, I hadn't, but yeah, I can only imagine.
It's the power of these tools too that we're trying to deploy at UMDF or are deploying. You mentioned earlier, Cassie, the patient populator registry. That's the very purpose of a tool like that, is to track this information so we can help solve mysteries, so we can help harmonize data and put data to work. Ultimately to chart a course towards treatments and cures. Heather, I want to shift a little bit. I want to move into, so there's Mito mom as caretaker. There's Mito mom as let's get things done. Let's advocate, and as Heather as an advocate. So talk to me a little bit about just your experiencing and advocating for your son's care, and maybe even taking a step further of advocating for these causes: mitochondrial disease, heart transplant, et cetera.
So as I said, I had very little knowledge as a physician about mitochondrial disease. And while we have a great care team, we're at CHO in Atlanta and we go to CHOP, but a lot of his other physicians do not know much about mitochondrial disease, if anything. And they have been wonderful. As you know, the most important thing that physicians need to do is talk to each other. We are a multidisciplinary team. We all need to work together for the care of the patient. But we've had issues where people just don't understand the risks, the stressors that can affect mitochondrial children. So just getting volume depleted or dehydrated, fasting. Our son's very susceptible to heat. So summer in Atlanta, 95 degrees. I mean, the last 2 summers in July, he was admitted. And I think some of that was because of the heat. And also they're very susceptible to infection. So our son, as you said, developed heart failure, and he eventually needed a transplant. And he was gifted one in July of 2021. And he's doing great now. But we, when you're on call in the hospital on a weekend, you don't have your regular team, and it's whoever's covering. And he was at a point where he just was not eating. He was nauseous and he was getting some fluids. And at one point, he even asked for a feeding tube. which is very abnormal for a 12-year-old boy.
Right. That's going to remind me how old he is. So 12.
He was 12 at the time. He's 15 now, but he's very good at being in the hospital and dealing with medical conditions. He knows his body and he knows when he needs to eat. And they kind of just gave us a funny look, like, we're not going to give you a feeding tube. Just sip your Gatorade. You'll be fine. And I remember advocating with the team that was on call saying, he cannot fast or he's at risk for having a stroke. And they're like, oh, we'll talk to the team. 30 minutes later, he couldn't tell me his name and he couldn't speak. So he had another metabolic stroke just from fasting. And they were, it can take days, but they're able to reverse his symptoms. He gets IV arginine and IV dextrose. But from now on, every time he got admitted, our team is extra cautious. And they're always amazing, but it's just not everyone knows the intricacies of dealing with a Mito kid.
Yeah. What advice would you give? So again, you said this intersection of certainly knowing a lot more than just being dangerous, right? You're educated on this front, and you've got your intuition. You get the Mito mom circle over here for families who may be getting on this journey. And may not have the confidence to advocate. Are there some tactics or tools that you would advise a fellow Mito mom, Mito dad, as they're thinking about advocating for their child's care?
I mean, I would just say, your child better than the physicians do. And we all have our knowledge base. The physicians know what they're doing in terms of whatever disease they're taking care of, but your kid. And if something's different or not right, or they need to follow a certain protocol, you can't be afraid to speak up because you're advocating for your child and their life. So
can you tell us, Heather, we've talked about this, this very unique position that you guys are in as a heart family and a Mito family, as a having had a child that has a transplant and mitochondrial disease. I mean, mitochondrial disease is complicated enough. How has being a transplant survivor and a heart kid?
It puts another layer there. So, I mean, we talked about stressors that we need to watch for mitochondrial children. When you add in the transplant, these children are on immunosuppressants, many of which can be toxic to the kidneys. It puts them at an increased risk for an infection. Our son was actually admitted for 2 weeks with strep throat and the original coronavirus that causes the common cold last year. So as you know, they're much more susceptible to infections and they're much harder to clear. And depending, there's this whole spectrum of mitochondrial diseases. Every child's symptoms could be different. But for our son, when he was admitted with the strep throat, he had a metabolic stroke again, and he had seizures for the first time, which is new for us. So we have to be very careful when you add the immunosuppressants in there.
I know you've found some ways to channel your energy and passion, and one is serving on the board of Enduring Hearts, which is an organization that supports pediatric heart transplant research. Tell us a little bit about your experience with Enduring Hearts, and let's give a shout out to a fellow nonprofit organization today.
Thank you. So Enduring Hearts is the only pediatric heart transplant nonprofit. And I found out about it when our son was very sick. So he was on life support. He was on ECMO. They did not think he was going to make it. And I was just feeling kind of hopeless, and I couldn't do anything to help. I was a helpless mom. I was not his doctor. At first I was trying to read his labs, but that's not my role. My role was to advocate for him. And that's when I found out about Enduring Hearts. We're very lucky. We live in Atlanta. We're within 30 minutes of the hospital. My husband's office is across the street. And we had a lot of resources in our community, but we were meeting other families who lived 5-6 hours away that were leaving their other kids or their spouse at home who had to work to maintain their insurance. So that's when we did our first fundraiser for Enduring Hearts. They have a Feed the Heart, a gas card program, and a grocery card program. So we supported that. And then we were involved in the midst of Jacob's transplant. And a few months later, I found out what the real gist of Enduring Hearts is to fund grant research to help these kids live longer lives. And, the average heart transplant, the median survival is about 17 years. That's what we were told when he first had his transplant. It's approaching up to 20 now, which is better. But as a mother, as a heart mom, we want these children who've been gifted a transplanted heart to have that gift last a lifetime. And as you know, I mean, a transplanted heart is a gift, and it's the ultimate gift because another family had the ultimate loss, and in their grief, they gave the gift of life. So we want that gift to last a lifetime.
So well put. Speaking of gifts, let's talk about the gifts Jacob brings to this world. Tell us a little bit more about what makes Jacob special.
He is the kindest, sweetest kid. He's 15. He has a 4-year-old brother who he loves to death.
Oh, how sweet.
An 11-year-old sister who he drives nuts. No, they will get along. But he's very kind and loving. He's great with little kids. I am the oldest of 5, and there are lots of little cousins, and he's kind of the ringleader, and he takes care of all of them.
It's good to have someone in charge, right? Speaking of which, too, just kind of going back to our conversation a little bit earlier, I think a place that you add so much insight and admittedly a place where so much more work needs to be done is on medical provider education. And while I have you here, let's just give me some advice. An organization like ours, who I think is doing a good job of starting to elevate the profile of mitochondrial disease. It was part of one of my major initiatives when I came here was to, I wanted less of me being at cocktail parties, someone saying Mito what when I introduced myself of what I do. And it's good to see it get kind of more into other conversations. But as we think about like that deep education or even a tertiary education for the medical community, give me some advice on kind of where you see some pinch points, some places to potentially improve.
I mean, that's an excellent question. So, I mean, there's education for the community and then education for medical providers. I would say it has definitely improved. But again, I'm only familiar with my institution. So I know at Emory, our Emory genetics team does do mitochondrial disease exposure workshops. I was actually able to participate in the last one as the mother of a patient. But that's an excellent question.
Maybe it's a softball to find a way to get you involved with us. How about that? I know we talked a little bit about this, that and maybe you can speak to this. There's, an organization like ours is always hungry, of course, to find passionate individuals to help move our mission forward.
And I'm happy to help.
And I'm glad. And I don't mean to put you on the spot on the podcast. You already shared that you were happy to help, but you talked a little bit in our pre-call about, finding that balance as, when you're on the mitochondrial disease journey, and there's different seasons of that journey, particularly of polling of time and resources, et cetera. If you could just share some kind of your own like thoughts and experience philosophy on like finding ways to get involved, all while doing number one job of being Mito mom and 1B and 1C of your daytime work, et cetera. Talk to us about balance in your life.
I think balance is hard for everyone, but I think just getting involved and putting yourself out there is very important. We were in the midst of our medical journey for a while, and it was only recently that I got involved in the pediatric heart transplant world. And I only am just exploring how I can help and give in the mitochondrial world. The first thing I did was to reach out to organizations like UMDF, and also just sharing my knowledge. So I actually met Cassie because I just happened to share some of UMDF's posts on LinkedIn, and we just had a great conversation. And it's interesting. I've only shared a few things about mitochondrial disease thus far, and I've already had other families reaching out to me, people that I didn't even know that were affected by mitochondrial disease. And just putting yourself out there and spreading the knowledge can help other families without you even knowing it.
the number of times, I think I speak for our entire staff, that we're wearing one of our t-shirts and someone stops us in a store and says, I shocked my neighbor when I first moved in here. There was one of my neighbors was doing a fundraiser for the Friedreich's Ataxia Research Alliance, a group that we collaborate with, a mitochondrial disease. And I saw a chalk drawing. They were doing, a drawing on their sidewalk. A little girl was drawing something for Farah. And of course, I had to introduce myself to this family, and they couldn't believe that the CEO of the United Mitochondrial Disease Foundation was just a half a block away. Mm-hmm. And to that point of, until we're out there saying things and we're drawing awareness to this, we can't make those connections. In a community our size, it's so important that we're constantly hitting that drum of awareness and communication. Cassie, to kind of bring it back to you, this is what you do every day.
Yeah. But Heather, thank you so much for coming on here and being willing to share your family's experience. I like to think of the fact that, hey, you can utilize social media and spread awareness and share your story. It's free, it's easy, but it's not. It's really not easy. There's an emotional cost. It's a lot of emotional effort and courage to get out there and talk about your experiences. So we just appreciate you and your willingness to be with us today and share with us.
Well, thank you for having me. I mean, you do have to be vulnerable to do it. It took me a while to even want to share my child's personal story. And I'm only doing it with his permission. Sure. We spoke again last night, and I was given permission because he also wants to help other kids. We've been very privileged by the doctors we've seen, by the team we've worked with. CHOP has been amazing. And he's actually on the alimiptoride study right now at CHOP. So, and that's been helping. So thank you so much. I'm sorry, my mind went blank.
No, this is great. And, outside of the time that it takes sometimes, Heather, to get to that point, I'll just close with this question, because I think, so many of the folks who tune into this are Mito moms, they're Mito dads, they're folks who share similar stories. And I've had people reach out to me to say, I caught that episode and I got this little nugget from that mom, from that dad, and that was meaningful to me. It makes me feel good. Sometimes when I look at my YouTube views, like, oh, I need to get these up a little bit. But when I know that one family connected on that, so I'm going to leave you with the last word on that. Just closing thoughts, closing advice for families who are navigating this journey and kind of finding their place on the journey. So much time is focused, as it should be, on your child, or if you're an adult patient, on you as a patient. I want to hear from you of what's important of taking care of you, yourself, mom, your relationships, et cetera. Give our community some of your thoughts on that, if you would.
I mean, that's an excellent question. It depends where you are in your journey. So there have been days where there have been hospital ICU stays, and there's a normal 7 a.m. shift transfer where you're kicked out of the hospital. And a lot of people, for a while, I was staying there, and I realized my mental health was much better when I went for a walk outside. And sometimes you don't have an hour. Sometimes you'll only have a few minutes. But connecting with your family, and I would also say, just when people offer help, it's normal to say, I don't need it, but sometimes just to take in whatever love and help and meals that your community is providing can be very helpful, not only for your mental well-being, but for your families to know that they're taken care of.
Excellent. So much sage advice today, Heather. We're delighted to have you with us today. I'm definitely going to take up in your offer to help us think through how we improve education from a clinician standpoint. So a place that we've gotten a really good start, but our work won't ever be done on that, right? This is, it's a long and important game for us to play. So thank you so much for your time, and we'll connect soon in the future.
Thank you so much.
All right, Cassie, a wonderful conversation. Thank you for introducing us to Dr. Gatcombe. I know you've mentioned the front of the show. The real joy of your job is making these connections and finding opportunities to learn more from folks. It's all about storytelling. You've been my deputy in terms of less pictures of mitochondria and more pictures and video of people, more stories. And Heather and her family were certainly no exception to that.
Yeah, absolutely. I mean, the power of the story. It's what connects us all, and it's how we make sense of the world and our place in it. And that's what's going to move the needle for us as a patient community toward treatments and cures.
So well put. I would be remiss with my social media manager on the call to not highlight ways to learn more and connect with us. Of course, umdf.org is always your hub for the latest and greatest of what's happening with UMDF. But Cassie does a fantastic job of keeping us all updated on our Facebook page. I hope it's not a kept secret, but we also have a Facebook support group as well too. So we don't talk about, I don't talk about that enough. And in some respects, it rivals our Facebook page in terms of number of people involved.
Oh, in every respect. It's a huge group of people.
Huge group, very active, great way to make connections. So if you're looking for UMDF support online, the Facebook group is a great place to check that out. Of course, our YouTube channel, where we do have our educational videos from our Mito University, which is both for clinicians and the patient family side. That's a place to check us out. Instagram, Twitter. What am I missing? I'm getting too old. Is there some LinkedIn? Of course, that's where you can find Dr. Gatcombe too. If you have feedback
there's tons of great conversation.
Connect with Dr. Gatcombe on LinkedIn. I'm on LinkedIn. You're on LinkedIn. Who isn't on LinkedIn? Is there anything else new in social media, Cassie? Like my kids tell me how lame I am, that I only talk about Facebook and Instagram. But is there anything else that we're on that I did not mention?
Not that we're on. I mean, there's all of the new things,
Is Andy TikToking yet?
The TikTok.
Yeah, we need to get Andy, your boss, TikToking. I think we're going to do that next. So
it's a good idea.
Speaking of which, a special thanks to our producer, Andy Dirth, our Director of Marketing Communications, for today's episode, which you can find on YouTube. Check us out there and reach out to us too. If you got great guests for this podcast, it might be that we always look for just champions of the mitochondrial world. That's what we're looking for here. So until next time, everyone, go fast.